Good morning, everyone. Today we'll be exploring the fascinating world of the cranial nerves, the 12 paired nerves that emerge directly from the brain and brainstem, playing a crucial role in sensory and motor functions. So, unlike the spinal nerves, cranial nerves primarily govern functions of the head and neck, through their influence extends further. They are indispensable for fundamental human abilities, including smell, vision, facial movement, hearing, speech, and swallowing. These nerves originated from the brain and brainstem, acting as a direct messenger. Let's begin with the first four cranial nerves. The first cranial nerve is the olfactory nerve, a purely sensory nerve responsible for the sense of smell. A damage can lead to anosmia or the loss of smell. And the optic nerve, also purely sensory, transmitting visual information from the retina. The damage can cause blindness or visual field defects. Oculomotor nerve, primarily motor, controlling most extrinsic eye muscles, eyelid elevation and pupil constriction. Lesion results in ptosis and eye deviation. The trochlear nerve, motor specifically innervating the superior oblique muscles for downward and lateral eye movement. Injury often causes diplopia, especially when looking down. The trigeminal nerve is the largest cranial nerve and the vital mixed nerve. It has three major divisions: ophthalmic, maxillary, mandibular. It provides sensory innervation to the face, scalp, teeth, and the oral cavity. It controls the muscles of mastication. A lesion can manifest as a facial numbness, tingling, and difficulty chewing. Abducens nerve, purely motor, innervating the lateral rectus muscle for eye abduction. Damage results in the inability to move the eye laterally. The facial nerve, a mixed nerve controlling facial expression, taste sensation, and stimulating salivary and lacrimal glands. A lesion can cause Bell palsy. Vestibio- Vestibulocular nerve, purely sensory with two branches for balance and hearing. Damage can lead to hearing loss, tinnitus, and vertigo. The glossopharyngeal nerve, a mixed nerve, involved a taste sensation, a gag reflex, swallowing, and salivation. Lesion can impair the gag reflex and taste perception. Vagus nerve, the longest cranial nerve with extensive parasympathetic control over thoracic and abdominal organ, vital for voice production and swallowing. Damage can cause hoarseness, difficulty swallowing, and autonomic dysregulation. Accessory nerve, a motor nerve controlling the sternocleidomastoid and trapezius muscles, forehead rotation, and shoulder elevation. Lesion can result in weakness during shoulder shrugging and difficulty turning the head. Hypoglossal nerve, a motor nerve dedicated to controlling the intrinsic and extrinsic muscle of the tongue, essential for speech and swallowing. Damage lead to tongue deviation toward the injury side upon protrusion. This is the origins and skull opening, navigating the cranial passages. Understanding where cranial nerves originated and exit the skull is fundamental for neurological assessment. Cranial nerves 1 and 2 arise from the cerebrum, while the rest emerge from the various parts of the brainstem. Each nerve passes through specific foramina, such as the cribriform plate for CN1 and the optic canal for CN2. Remember the cranial nerves? Memorizing the cranial nerves and their functions can be challenging. Fortunately, mnemonic can help for names like O to touch and feel very good velveta. For function types, some say merry money, but my brother says big brains matter most. Integrity of the cranial nerves is vital for proper neurological function. Lesion or damage can produce distinct symptoms. For example, anosmia points to CN1 dysfunction, while stosis in diplopia are common signs of CN3 and or 6 involvement. In summary, the pair of cranial nerves are integral to the body complex neurological network. Mastery of this anatomy and function is crucial for healthcare professionals for diagnosis and treatment of neurological disorders. From the subtle sensation of the scent to the complex coordination of the speech and movement, the cranial nerves are truly the unsung heroes, orchestrating our sensory experiences and motor capabilities. So, thank you for your time.